All right, so I finished examining you, and based on your history, what you've been telling me in your physical exam, what I think is going on is just you have a cold or a flu going on, and all you really need is some rest.
Doctor, are you sure? I feel like I need antibiotics. I have this headache that won't go away. My nose keeps running. I have this cough. I really think I need antibiotics.
Yeah, I understand it doesn't feel good, but like I said, it's likely a cold or flu based on everything you've told me.
But doctor, it's been 2 days. 2 days of this. I don't think I can go any longer. I think I need antibiotics.
Okay, let's have a talk about antibiotics. Antibiotics are great medicines. They're used for a lot of different bacterial infections, including strep throat, urinary tract infections, sexually transmitted diseases, and certain pneumonias. There's some cases where antibiotics may not be the best medicine, and those are the cold, the flu. Most sore throats are caused by viruses as well, so those don't have any benefit with antibiotics. As well as sinusitis if it lasts less than 10 days, generally due to viral causes as well. But you may ask, what's the harm of using antibiotics? Well, there can be a couple of different things that can happen if you use antibiotics when you don't need them. Antibiotics themselves have some pretty bad side effects at times, and those can include nausea, vomiting, diarrhea, which are not pretty pleasant if you don't need them. Some other complications of antibiotics that you can see are antibiotic resistance. And that is when you're using antibiotics for diseases that don't need antibiotics, and bugs that are in your body develop a resistance to these drugs. And in the future, you may not be able to use these antibiotics for your infection, and this can cause a term we call antibiotic resistance, which is becoming more and more prevalent nowadays. So what can you do to prevent antibiotic resistance? You can take your medication as prescribed by your doctor. So if your doctor prescribes you 10 days of antibiotics and tells you to take 2 tablets a day, make sure you're taking every tablet as prescribed. Don't give your medication to anyone else that it hasn't been prescribed to, and don't take medication from anyone else that hasn't been prescribed to you. And also make sure that you are not pressuring your doctor for antibiotics or your nurse if they don't think that you need antibiotics.